Ghana and, of course, other parts of East Africa as well. And the most vulnerable are children, women, and the elderly. I beg your pardon. And today in studio, we want to talk about how the elderly are being affected by drought here in Kenya. And HelpAge International has been part of the groups that are looking into helping and assisting and being able to interact with these people, come up with solutions, and also just paint a picture to the world of what is unfolding. So joining us in studio this morning on my extreme right is Justin Dabsher, who's CEO of HelpAge International. And next to me is Kenyatta Maitha, who's Director HelpAge Kenya. Gentlemen, thank you for being with us on Worldview. I'll begin with you, Maitha, to paint for us a picture. We've seen what's happening in Turkana. Turkana is not the only region that's affected by this drought. And as far as your work is concerned, what have you found?
Well, thank you, Sophia. The situation on the ground is really disturbing. Of course, you find many communities around there struggling to get food for the animals actually dying. You've seen from the footage. The levels of malnutrition is also very high. But as an organization that works with and for older persons, one of the things that's really striking is the fact that you find older persons, the burden of care of older persons increasing as the younger populations move to other areas to look for animal fodder and also to look for water. So you find they care for young children. Sometimes when relief is actually provided, they have to, they cannot walk to these relief centers where the supply is actually delivered. You also realize some of the older persons already, their health conditions are not necessarily good. So the humanitarian crisis has actually aggravated this, and you really find that many of them are struggling. Of course, a lot is already going on. The national government, through the National Drought Management Authority, has been reaching out to these communities, and also the county government has also been doing that, and other humanitarian agencies. But the scale and magnitude of this humanitarian crisis is very significant, and I think that's where we come in as also partners in that way of trying to see how we can contribute. Yes.
All right, Dabsher, you toured northern Kenya. Paint for us a picture of what you saw.
What we saw actually was a really severe situation, I think, and I met a number of older people whose lives are being devastated by this drought. And in terms of one individual, John, I met yesterday, he was 79 years old, and unlike the situation in 2010, 2011, where they had migrated to other areas to find pasture, after 2 seasons of failed rains, they tried to migrate again, but the whole of Turkana County and the surrounding counties have been devastated by this drought. And so during this process, he has lost 95% of his livestock and is left with just 2 sheep left to be able to survive with and to utilize for his livelihood.
Yeah. And how is it you come in to help?
What we're trying to do here is work with other actors, because obviously it's affecting older people, but it's affecting their families as well. And so we have to look at an integrated approach and collaborate with other NGO partners, as well as with the National Drought Management Authority and the state government.
Yeah.
What we're trying to do initially is cash transfer programs to be able to give older people and their families the funds they need to be able to provide food and hopefully restock their livelihoods.
Yeah.
And then from that, we're also providing water purification tablets. All of the wells that we saw yesterday had been dried up, and now families who were used to travelling 2-3 kilometres to access water were travelling 12 kilometres to access water.
Let me bring this to both of you, because there are those who look at what's happening in Kenya and say these are not incidents and scenarios that just happen. In terms of weather patterns, in terms of the situations we've seen in the past years, it's expected that, next year we'll witness at some point another situation like this. So do organizations like yourselves get frustrated with the Kenyan government that there's not enough done in the interim period before we have this kind of situations facing people, so that we now, yes, at this point you're helping the communities, the elderly, and other organizations are coming in, but that why can't can't more be done to avoid these scenarios?
Okay, let me try to answer that.
Yeah.
Well, I think it's not really a question of whether the government is doing enough or not, but it's more about sometimes the scale of the emergency. Before this drought situation worsened, the government has been implementing a number of safety nets. We have the hunger safety net program, whereby counties like Turkana, Marsabit, Wajir, and Mandera, the households, around 1.5 million, had been targeted, and around 100,000 of those households have been getting 2,700 per month in terms of cushioning them against extreme shocks. And also, in terms of when the weather conditions worsen, there is another facility that is actually added on other groups.
Yeah.
So in other words, and that is not only the initiative that the government has been doing. We've seen both the county government, the national government putting up water points in different
So you're
places.
just saying this is a difficult situation
Yes.
that nobody can help. It just has to be as
It is a difficult situation. Of
Yeah.
course, the national government has even the emergency funds, counties, also CDF committees, but the scale and magnitude of this crisis requires everyone to contribute in whatever way they can. So it's not really a factor of government not being prepared,
Yeah.
but also we understand also weather changes. Imagine 2 seasons where we've not had rains. So that's the way the situation is.
All right.
Yeah.
And as HelpAge, is it just Kenya you're working with, or are there other countries, and how, what kind of mitigation efforts are being put there as well?
So we are working across East Africa, in South Sudan, in Ethiopia, to react to this huge crisis that we are now faced with. We're looking through there at, again, providing cash transfer programs is a very successful way. Kenya government, with the British government support, has really profiled that with the Hunger Safety Net program, which has been a huge success. After the last drought in 2010-2011, it was shown that the Hunger Safety Net program had had a really big effect in supporting those families and making them more resilient. What we therefore need is to grow programs like that, to improve the social protection systems in Kenya, in Ethiopia, and in South Sudan. So we're making communities and their families and older people more resilient.
Yeah.
We had a great announcement last week in Kenya in the budget where the government announced that it would roll out a social pension for everybody over 70 from the beginning of 2018. That's a fantastic move because it would enable them to have basic support throughout the year.
Yeah. And Maida, would you say the social welfare scheme, you know, in as far as the elderly are concerned in Kenya, is one that is airtight, or there's still more work that can be done, of course, following even the announcement that was made?
Well, when you look at the last 4 years in terms of the safety nets, the government safety nets, we have the national safety net program. The government has increased the amount allocated for the older persons, cash transfer, also for the orphans, and also for people living with disability. And this is a good good beginning for in terms of cushioning those communities or vulnerable groups that are at risk whenever we have a drought of this kind of magnitude. But I think there is a lot more that needs to be done in terms of cushioning ourselves in the long term, so that then we do not find ourselves in this kind of situation.
Okay.
Yeah.
As we bring this to a close, because I was reading that there are, in some instances, communities where you find half the population is the elderly, because you have the stronger men and women going out, you know, and moving to the urban areas to look for work. So it's the elderly taking care of grandchildren. That must be heartbreaking.
It is, and this is a global phenomenon. It's not just in Kenya, but
Yeah.
you do see it. It's because of issues of migration. We're now seeing a lot of rural areas dominated by the very old and the very young, and it's the elderly people who are being left responsible for caring for the children. And so that's why it's equally important to support both communities and to look at an integrated approach to this, rather than trying to specifically target one or another. What we're also looking for, I guess, is more resilient approaches to allow us to support to communities where people are migrating to urban areas.
All right. Thank you very much, gentlemen, for being with us this morning. Justin Debsher, CEO HelpAge International, Kenyatta Maitha, Director HelpAge Kenya, as well with us, talking about drought and the impact of the same on the elderly, not only here in the country, but across the regions you've been able to work in. We thank you for being with us.